Cian Corla. Minister, the question I have concerns the overrun. Obviously, we're looking at a very hefty overrun for this year. Worryingly, that has been locked into next year as well. So I think 625 million is accounted for based on the overrun for this year, which, by my reading, is money that we could be spending and should be spending on Sláinte Care and on scaling up the system and so forth. So my question is, when was the overrun signalled to you? Was it signalled in late 2017, early 2018? If it was, what steps did you take to try and avoid this very significant overrun? And could you give us the details of what has caused the overrun for this year? Thank you.
Thank you very much, Cian Corla. I want to thank Deputy Donnelly for the question. A number of areas within the HSE are contributing to an overspend in 2018. These include higher payouts under the State Claims Agency, a shortfall in private patient income, a higher level of spend in the acute and disability sectors, and, for example, the additional costs associated with Storm Emma, which amounted to about 40 million in and of themselves. The overspend in services is driven by non-achievement of planned savings, higher levels and higher complexity of demand, costs associated with meeting national regulatory standards in the disability sector, and the need for additional emergency placements for children and young people with disabilities. Finally, and importantly, an amount of 280 million was provided in the 2018 revised estimates for appropriations and aid receipts from the UK in respect of healthcare provided under EU regulations. These receipts are now estimated at 225 million, leaving a shortfall of 55 million against the provision. The HSE advises in relation to your question that the savings projected to be achieved by year end under the Value Improvement Programme will be in the region of €80 million. The introduction of a savings programme into the HSE's 2018 National Service Plan reflects the commitment that we must have in the health service to achieve greater value and efficiency across the totality of resources at its disposal. With major increases in public funding for our health services in recent years to a level which does now compare favourably with spending in other countries, it is important that the scope to develop services through the improved management of existing resources also receives ongoing attention. In presenting its 2018 National Service Plan in late 2017, the HSE conveyed its view of what it saw as a significant financial challenge in implementing the plan within the allocated budget for 2018. Of course, this wasn't a secret. It was published on page 2 and 3 of the National Service Plan. In response, I confirmed to the HSE that the plan was to be framed having regard to the funding available. The health sector was but one area of several priority areas competing for additional funding in 2018 from the overall fiscal space available to government. I pointed out that over 600 million in additional funding was provided for the health sector in the 2018 budget, and that the HSE's allocation had increased by approximately 20% since 2015, or an average of 6.6% per annum, which is ahead of both the programme for government and the confidence and supply level of increase. Taking the significant 2018 and prior year allocations into account, it is clear that issues of budgetary performance need to be addressed in certain areas, and the HSE should discharge its accountability in this regard under the Performance and Accountability Framework.
Official record, Deputy Donnelly.
Thank you, Cian Corla. Minister, what I'm hearing from you causes concern, because the HSE, you're telling us, told you towards the end of last year, they said, this isn't a big enough budget and we're going to have an overrun. Now, I'll read back on exactly what you've said, but my understanding of what you've said is that you heard that and you told them that they needed to go back and they needed to come up with a service plan within budget. I'm assuming that is what you did. So can I ask you, if the HSE, you got the budget you got, that the Dáil voted you, the HSE came back to you late last year and said, Minister, this isn't enough money for the service plan, so you got to do one of two things. You got to either increase the budget or we've got to reduce the service plan. Did you instruct them to reduce the service plan to make sure that they could deliver on budget, which presumably you did? And if you did that, then what has happened to lead to a nearly 800 million overrun? I think saying things like Storm Emma and unforeseen events, I don't think that's an acceptable rationale. If you're running a 16-17 billion euro healthcare system, storms happen, flu epidemics happen.
Thank you, Deputy.
You plan for the unforeseen and you make sure you have contingency budgets in place. So can I ask, did you ask the HSE to reduce their service plan to a level that should have allowed them and you deliver according to budget? Thank you.
Well, of course, the HSE didn't just tell me, they told us all in the HSE service plan, as they do most years, the challenges and risks that exist in an organisation like the HSE. And remember, Deputy Donnelly, this is not the first year that the HSE has needed a supplementary budget. If you look back to 2006, where we had long-stay charges repayment scheme of €1 billion, if you look back to shortfalls of 240 million in overrun and demand-led schemes in 2007, 345 million in 2008, 595 million in 2010, 680 million in 2014. This is not, by the way, I'm not saying this as a good thing, but I think the reason we all know that we need to reform our health service so that it can actually deliver value for money and improve services is why we've all signed up to the Sláintecare plan. The HSE, and the law is very clear on this, the HSE has a legal obligation under the Health Act to present a service plan that it signs up to delivering. So yes, it can highlight risks and it can highlight challenges, and it did highlight those risks and challenges to me. But ultimately, when it submits a service plan to the Minister of the day, it is committing to deliver the services contained within this service plan. That is their legal responsibility that they're taking on. Now, I do think we need to improve the oversight and governance structures. That's why I have appointed Sir Kieran Devan as the new chair designate of the HSE board. That's why I do want to put a competency-based board in place as well. But you may say, you know, Storm Emma or State Claims Agency doesn't explain it. Well, it does explain a fair bit of it, because if you have, let's just take the State Claims Agency, you cannot predict the level of claims being paid out every year, and it was clear there was an overrun in that area. It is clear that Storm Emma cost €40 million, but it was also clear, let's be honest, that both when it came to our acute hospitals and our disability sector, that there was a significant overspend. Now, when you say what options, you know, what did you tell the HSE to do? Well, what I certainly didn't say was reduce those services, because you don't have the luxury when you're health minister to tell sick people that they're to go home and come back next year. So we have to manage, and that's the situation that myself and all my predecessors have found themselves in.
Thank you, Minister. Look, if we in the Dáil vote you a certain amount of money, and last year it was north of €15 billion, and the HSE comes to you and says, Minister, we can't deliver the service plan for the amount of money that you have got from the Dáil. You have two choices. Well, you have three choices. One is you can come back to the Dáil and say, actually, I need an extra whatever it is, whatever they tell you, 600, 700, 800 million euro. The other is you can go back to the HSE and say, look, I'm sorry, but this is the amount of money that Dáil Éireann has voted me, and we're going to have to figure out how to bring this in on budget. And of course, no one is suggesting that you turn sick people away. Nobody is suggesting that, and you know that's not being suggested. But anyone managing a budget anywhere in the world says, this is what I'm going to deliver, this is the amount of money I have. But the third thing, which is what actually happened, is, if I understand you, is you didn't tell them to adjust the service plan according to the budget. Therefore, they're warning that they didn't have enough money held, and we end up where we are now, which is with a nearly 800 million overrun. So can I ask, through the year, was anything done? Did you instruct the HSE to adjust the service plan or the capital expenditure on whatever it was to bring it in on budget? Thank you.
Minister.
So that's not what the HSE said, Deputy Donnelly. The HSE did not say we cannot deliver the service plan. The HSE produced a service plan. It was launched by the then Director General and myself. It was discussed at the Oireachtas Health Committee. I'm pretty sure it was debated on this floor. And they produced that in the knowledge of the resources they had available to them. Yes, they did spell out, both in correspondence to me, which has been long since published, and on page 2 and 3 of the service plan, the risks and the challenges that they saw. If you look back through all service plans, the risks and the challenges are always highlighted. So nobody in the HSE said, nor legally could they have said, that we are producing a service plan that we don't believe we have adequate resources to deliver. They have an obligation in producing a service plan that they can deliver within the resources. However, having said that, it is also clear that when you look at the HSE's budgetary performance since its establishment, it has almost always required a supplementary budget. And I suppose the question for all of us in this House, and the question for me as Minister, is how do we endeavour to move to a better place in that regard? I think the governance piece that we're putting in place is a part of it, but I also think reforming the model of healthcare is a part of it. You and I suppose, have somewhat of the luxury of looking at the available resources just from a health prism. Both your party and this government, when we sat down in budgetary talks last year, had to decide how much money we could give to health and had to do our very best within that envelope. And I didn't see anybody agitating for any more than was given on budget day.
Deputy Louise